One ambulance, rigged with cameras for the first time ever, to show you what goes on behind closed doors. Body-mounted cameras record everything.
Oh, it's going to be another 2-hour session of wearing the man bra.
Hello, you okay?
Am I turned on?
Yeah.
Oh, no, I'm not. No, I'm not.
Apparently it's going to be a fisheye lens on it. It's going to make your face look even fatter than it is.
Where's the button, Jamie?
It's there.
We'll reveal what it's really like
So where are you hurting?
to be a paramedic.
Hello there, Lawrence.
Do you know what? High five, yeah, well done, love.
We're with the West Midlands Ambulance Service.
We get life, we get death. We have a bit of everything.
As they deal with 3,000 emergency calls each day.
We're not in the Bronx.
Yes!
I think it's red one, let's go. Blue light.
Taking you right to the heart of the action.
You comfy there?
Not really.
Alright.
That's the worst bit over, almost.
I had a job on the golf course there once. I had to go and use the buggy to get to the patient. It was great.
Did you? I had a job on Oxley Golf Course and I drove the ambulance all over the greens and the fairways.
Oh my god. I bet they were livid, weren't they?
The groundskeeper was going mad.
Have you ever been to a bingo place when somebody's ill?
Yeah.
We went in the middle of a game. Person, chest pain. Started talking to him. Woman at the side was going, shh, can't hear the numbers.
This chappie opens the door and then he said, oh, I am sorry, I was intending on cancelling you. It's okay now, we've resolved the issue. Father had got his pants on back to front. He needed to use the toilet and couldn't find the hole. But I've rectified the situation now, so you're not needed. Normally, they contact me first, but I was out walking the cat round the field at the time.
Walking the cat?
He said the cat does insist on a walk round the field 3 times a day, and I thought, he doesn't though, does he? The cat doesn't insist.
It's Saturday evening.
Have we cleared?
No. Are we good to go?
Yeah. We ready for the next challenge? Might need to...
Yeah, I do sit quite far away. Like a go-kart.
And yet you're not that tall, really.
Thanks for that, Loz.
No, I mean,
I
like...
didn't know that. Can't reach high things.
Yeah.
Me and Bethan have, when we go on an escalator, she has to stand 1 step below me. It's the only time I'm ever taller than her.
That's funny.
Loz Horrobin and Dan Smith are on the night shift, from 6:30 on Saturday evening until 6:30 on Sunday morning.
Good, Dan, I've got the yawns already.
I know, I'm starting to feel a bit tired. It's like 10 o'clock. You are all right there.
Thank you.
I need a job.
We do. Keeping the West Midlands safe.
A 999 call comes through. It's a Red 2, the second most urgent category of case. The patient is a man struggling to breathe.
Says sudden onset of breathing problems with chest and upper back pain. So it's deciding whether it's respiratory or related to the heart.
Dan has been an ambulance technician for 2 years, but he's now training to be a paramedic and is keen to use his more advanced skills.
It's just on the left here.
They arrive at the house.
Just be a sec, okay?
and they find the patient's sister anxiously waiting for them at the door.
Is it you we've come to see?
Yeah, can't get breath.
Can't get your breath. Okay, so what I'm going to do, I'm going to have a little listen to your chest, all
I'm
right?
diabetic.
You're a diabetic. Do you have any problems with your breathing?
No.
No. Okay.
Just relax your hand for me.
All right, thank you.
Set to 90 at the moment. Just going to pop this over your face, John, okay?
Have you seen him at all today?
Just breathe normally, okay? Just going to help open the airways up, okay? Because you've got a bit of wheezing on your chest. So it will just expand the little airways down in the bottom of your lungs. Hopefully you'll be able to breathe a bit more easier.
His oxygen levels were low because he was breathing quite quickly.
It can also be the cardiovascular system, so if there's heart failure, you get a retention of fluid. Just going to pop some stickers on your hands and your ankles, okay, just to do a heart tracing.
John's 72 and had a stroke 6 years ago.
Can we just do a more in-depth heart tracing, John? Put some more stickers on your chest.
Loz has spotted something worrying on the heart monitor. She needs to get more readings.
Okay, John, if you just relax your hands onto your lap for me. Okay.
So this shortness of breath that you've got, does it get worse when you're moving around the house? No. So the last 2 days, it's not really been affecting you apart from when you lie down?
Okay.
Her fears are confirmed.
Looks like a left bundle.
From the pattern of John's heartbeat, she can see he's got significant heart disease.
No one's ever mentioned a left bundle branch block to you before, have they, John?
No.
It's the way your heart beats.
Frightening.
It's understandable.
Okay, John. When we did a 12-lead ECG, which was the stickers on John's chest, we discovered what we call a left bundle branch block. Basically means the electrical impulse has to travel further due to a blockage. If you've got chest pain and you've got a left bundle, it could be a heart attack.
There we go. Get you nice and sat upright, John.
Okay, John, if you can have a seat on that stretcher for me. Are you okay to shuffle across? Okay. Push your bum right back in there so we can get you sat straight up there.
And then swing these legs up.
With his heart not working properly, John is struggling to breathe again.
You've not been into hospital recently at all? No surgery or anything?
No.
So that little bit of exertion just from the stairs to the chair's really taken your breath away, hasn't it? And when was the last time you saw your GP, John?
Put that on your finger for me. Just catch your breath, John.
Sometime last year.
So it's been a while.
Yeah.
Right, let's give you some fresh air.
Just have your wrist, John. Just relax for me, that's it.
They've been treating John for 27 minutes. Now they need to get him to hospital as quickly as possible for urgent tests on his heart.
So what time did you get short of breath this evening? Was it just before you called us? Yeah.
Loz and Dan have managed to stabilise John's breathing and his oxygen levels, but he urgently needs to see a cardiac specialist to work out the severity of his heart disease.
Sit back for me, John. That's it. Okay, we're all plugged in.
If they do find evidence of heart failure, he'll need immediate surgery.
Okay. think John's got heart failure. It's quite testing, this job, sometimes, because, like, you go to 10 people with the same problem, everyone is different how you treat them, and then it's just making your decision what you're going to do.
And a lot of the time, it's little things that indicate really big things, isn't it?
Yeah. He's got no previous heart problems, and there's no heart problems in the family, but, like, when they get older, things start to fail, don't they?
It's just preempting those things and making sure you point people in the right direction.
Definitely.
Road activated.
So good that we've got the sat-nav on there, because if we had to get to addresses in like Walsall and Bloxwich and stuff, I wouldn't have a clue where I'm going. Would you? I don't think it would be too bad in Walls. I could like plough my way through it. Could you imagine like being sent to Birmingham without the sat-nav?
Mate, I don't know I'm going to Birmingham with the sat-nav.
It'd be an absolute nightmare.
Did they teach you on your driving course to read an A to Z?
No.
We had to be taught on how to use an A to Z. So it was just like, right, okay, we've got no sat-nav, direct them.
That would be my worst nightmare.
You're not map readers.
Nah.
Go back to that, go to interview, and then click now. Make a paramedic out of you, guys.
Hannah Simpkins and Michelle McNulty are just coming off their break.
I can probably count on one hand how many times I've laughed so hard and cried with laughter. One of them was when I stalled the engine, which then turned the blues and the lights off. So I started the engine again, but I forgot that the blues had gone off. So I'm trying to start the sirens again, but it's just going, So Jack just goes, shall I be the siren, shall I? So he winds down his window and he's going, Nina, Nina. And this woman is just sat opposite me, and I'm just laughing.
What is this lunacy?
And she's looking at me like, what is she doing?
These people are employed to save our lives.
Yeah.
It's a 26-year-old female that's fallen with a head injury and a foot injury.
I'm just going to buzz on and see if she's actually like fallen off anything. 4362.
62, go ahead.
62, reference to this job. Just wondering if the patient has fallen from height or anything.
Your report is still in progress.
That's all received, thank you.
7 minutes after the call came in, Hannah and Michelle are on scene.
Stop.
But Hannah spots a problem.
I think they've got a punctured tyre. Something's hissing, but I don't know what it is.
The puncture will have to wait. The paramedics' body cameras capture everything they do firsthand. Inside, 26-year-old Heather is in agony.
Hello? Hiya. You okay, chick?
Not really.
What's happened?
I only went to call the shower about 20 minutes ago.
Yeah.
And I've gone down the steps, because they're awkward, as you can see, coming up.
Yeah.
I've gone in the back of my head, my neck is burnt in big stone. I thought to go the opposite way.
Can you not move it at all?
How have you got back in the house, chick?
I crawled.
She crawled up the stairs, okay.
Let's have a look.
Can you describe how you fell to me? Were you walking up the stairs, did you say, or down the stairs?
Just went,
and you were on...
it went crack.
Okay,
I just thought you can't even move my toes.
You can't wiggle your toes. Okay, I'm not going to touch this side of your foot, but I need to touch about here, see if you've got a pulse in your foot, okay? Patients like Heather who've got a suspected fracture need to make sure that there's no damage to the circulation. So if the bone blocks an artery, then it can stop the circulation from getting to the rest of the limb, which means there's no blood flow there and eventually the tissue will die, which can be far more serious. You got any pain up here?
Here.
Here, okay. I'm just going to rest my hand on the back of there, all right? I'm not going to press or anything. All right, sorry, sorry.
Heather also has pain in her back from when she fell.
Look at the back here. Where's it hurting? Along here?
Yeah.
And did you bang your head as well? Yeah.
Does it hurt when I'm touching?
Yeah.
You know when you fell? Did you feel faint or anything beforehand? You did?
I don't think it's normal because I've been being on a diet anyway, because, you know, if you're at a juice plus.
Heather's been on a juice diet for the last 5 days. It's possible that her low calorific intake has caused her to fall.
I had one of my shakes and I was sick.
Yeah.
So I just thought nothing of this and went to pull my rubbish out and I just went, and then I had to sit there for about 5 minutes because I couldn't even move.
On top of all that, Heather's just had her appendix removed and recently dislocated her hip.
You're not having much luck, are you, really?
I think it's his head's cursed.
Well, they say it comes in threes, so you've had your hip, your appendix, and now
this.
You're obviously going to need it x-rayed because you can't weight bear and you can't rotate it, you can't move it. And you have got quite a bit, I'm not going to touch it, don't worry, you've got quite a bit of swelling all around your ankle here. It might be...
I think it's starting to bruise already.
It might
Really?
be that you've broken it. It could also be...
I don't know, I broke it when I was 10.
Did you? Same leg?
Same ankle.
It might be ligament damage, it might be pulled muscle or something like that, but given the amount of lack of movement that you've got in it, you're going to need an x-ray anyway. We'll go and get you a chair, obviously, to get you outside. We'll pop you up for an x-ray, sweetie, all right?
But it's not going to be quite as straightforward as that.
Right, the other issue that we have is that our ambulance has a punctured tyre. So, there will be another ambulance. We're going to sort you out now, do some paperwork, finish your observations.
How have you managed to get a flat tyre?
It's got, I'm not kidding you, a rock about that big in it, and the rock has got a point on it, and I've tried to, like, wiggle it and move it, and it is literally, you can hear the hissing as you're driving along.
Control?
Yeah, I've told them. They're going to send a different ambulance to take you to hospital, OK? But in the meantime, we'll start you with some gas and air, all right?
Yeah.
Right, you know what you're doing?
Yeah.
Nice, slow, deep breaths. If it makes you feel sick or anything like that, then stop. Keep it in your mouth. You can exhale through the mouthpiece as well. Might make you feel dizzy and a bit like you've had a beverage or two, probably.
4362.
62, sorry to bother you. It's Royal Logistics. We've got a puncture. Just wanted to know what wheel position it was on, please, Evan.
It is the rear tyre on the right-hand side, on the driver's side.
Yeah, received, no problems at all. Is it totally flat?
It certainly is flat as a pancake, over.
I'll keep you updated, Keith.
Hello, you all right? Our tyre's flat as a pancake. So
Yes,
we
I
have,
spotted it.
Yes, we have called for your lovely selves. Patients inside of it, shall I give you a handover? All right.
The second crew can now take Heather to hospital. In order to protect her back and neck, they immobilise her before moving her.
It does the job and it keeps you still. All right.
Right, I've got your arms, that's it.
That's it, that's it.
Ow.
You'll feel like you trust him.
As Hannah's ambulance is out of action, Heather will now be cared for by the second crew.
That's the worst bit over. All right.
It hurt. I've never known it so painful.
I'll get you sorted, don't worry, OK? Phone, slipper, top, OK? Put them there between your legs.
With Heather safely in the ambulance, she can go to A&E. But Michelle and Hannah are going nowhere till they get their puncture fixed.
I hate going over these levels.
I know. Do you know what? I always think there's going to be a train coming at some point. Oh no.
Do you keep your eyes open or do you shut them?
What do you mean? So I keep my eyes open?
If I'm going through a level crossing, I slow down, but I shut my eyes just in case. Yeah, if I'm going to be hit by a train, I don't want my eyes open when it happens.
That's true. Oh yeah, I wouldn't want to see my fate coming towards me. No, after I've seen what a train can actually do to a person.
Gaz Clark and Mike Arrowsmith are on a day shift, but Gaz is already thinking about the weekend.
Meant to be going away with the army.
This weekend?
Yeah.
Was it? Where was you meant to be going?
Just down Monmouth.
What, so do you go down there as a medic? Or?
Yeah. I'm the regimental medic for the Royal Monmouthshire Royal Engineers.
For the what?
Royal Monmouthshire Royal Engineers.
Monmouthshire?
Yeah.
Royal Engineers, is that the same as the REME?
No.
What's the REME then?
Royal Engineers Miners Education. No, Royal Electrical and Mechanical Engineers. They're mechanics, they're the AA.
I can see you getting a lot of hate mail after that.
Oh God, yes, most definitely. Yeah.
They're called to a GP's surgery, where a 10-week-old baby is making what's described as a grunting sound each time he breathes.
Hiya.
Hello there. What's been going on then, Mum?
He's got really noisy breathing and
Right.
chest. And he's been in hospital with it already. Just keep sending him home.
Right.
The muscles between baby Akoni's ribs are sucking in, a sign of respiratory distress. Mike Arrowsmith and Gaz Clark have been called to a GP's surgery to see a 10-week-old baby who's showing signs of respiratory distress. Baby Akoni is making a grunting sound each time he breathes. The GP has already phoned the hospital's paediatric assessment unit.
So I spoke to PAU and I said, look, can I just admit him to PAU directly? He did the letter and I said, no, if he's grunting, he needs to go to A&E.
If you can just lift him up to you, Mum, put his chest onto yours. No, so he's vertical. Any breathing problems, we need him vertical. That's lovely.
Akoni's breathing is clearly laboured. Mike attaches a probe to the baby's toes to check the level of oxygen in his blood.
Does his breathing ever get better than this?
You know, when he's sleeping, he's fine.
When he's not really thinking about it, chilled, relaxed, breathing's normal. But it does seem in the upper throat rather than his chest.
When Lisa feeds the baby, the grunting noise also stops.
If it was bronchitis, you'd be able to hear it in his lungs, wouldn't you?
More so, yes. It depends how you're listening at the time and that. You normally need to listen to the front and back. I've listened to the back. The back of your chest being the longer part of your lungs. And not as much in the way. So you tend to hear quite well. Thank you, nephew.
The family live just across the road from the surgery, so Lisa's going to nip home for the car seat, leaving Mike holding the baby.
We'll come back in a minute.
Hello.
You don't look very comfy there, mate.
Once they've got the car seat, they can start the journey to Walsall Manor Hospital.
He's more chilled.
Yeah.
Doesn't the same noise.
It's like I don't get why.
Nah. It needs further investigation. The doctor's right, and if he makes a referral, it takes time. If we go up now, like we tried to get him in at PAU, which is exactly the right place to go.
But Akoni soon becomes distressed.
He's going to start holding it.
Nice, he wants a bottle of it.
No, he don't. He just don't like coughing. Yeah.
Oh, mate.
No, he don't like anything staining like this.
Gaz needs to calm down his breathing so his condition doesn't worsen.
Standing up in the back, Mike.
All right, mate.
Come here.
Look at the chest, look at the chest. Hey, I've got chest.
Sat back down.
Once Akoni calms back down, they continue their journey. And just 4 minutes later, they arrive at hospital where Akoni can be assessed by paediatricians.
Yeah, nice and steady on the ramp there.
999 road.
It's 10 to 9 in the morning. Dan Edwards and Mike Arrowsmith have been sent to Wednesbury.
A 50-year-old male, stroke neurological fitting.
Able to be rolled onto his side. What's in the
So he's
notes?
had a fit, hasn't he? Patient is having a stroke and having a seizure. Hello? Upstairs? You alright?
Hi, mate.
What's going on?
Hello.
I had another stroke, I think.
What makes you think that?
Because I've had 5.
And have
The
these...
last one I had, this went, and the one just, all that went again.
Dale's care assistant Tammy was in the house when he became ill.
He has passed out, top of the stairs, twitching to the right-hand side of the face. He's got tingling sensation to his left hand, which he said he's now coming back. He's got up quite disorientated. He was quite clammy to the back.
So it was like his muscle spasm inside
Yeah.
of it. It wasn't a droop or anything like that.
No, it's more like a muscle spasm.
Since Dale's first stroke 3 years ago, he's had limited use of his left arm.
Squeeze my hand as tight as you can. Squeeze. You won't hurt, okay, so squeeze as tight as you can. Hold your hands out in front of you, close your eyes.
I've been all right for 14 months.
Right.
And it was exactly the same as the last one I had. But it's all to do with this.
Dale has previously had an operation to clear a blocked artery in his neck, one of the most common causes of strokes.
They got the cholesterol down to, I think it's 3.7 now, because it was all to do with all that.
Yeah. I mean, there's...
Mike tests Dale's temperature, heart rate and blood pressure. They're all normal.
Whether you've got anything going on or you've had something going on remains to be seen, and there's not a lot we can really do here to prove that. It's more than likely going to be a trip up the hospital, chap, all right?
Better to be safe
I'm
than
used to
sorry.
it now, yeah.
Yeah. No, keep it up there.
Oh, yeah, that's in the car, yeah.
Do you want to go on a chair or do you want to sit on a bed?
Yeah, I'll sit in the chair.
Dale's not been able to work since he had his first stroke.
So what, this say it was all due to your cholesterol, did they, originally? Is that what they put it down to?
High blood pressure, cholesterol, smoking 60 a day, drinking 25 pints a day, straight at the pub, winding down, you know what I mean, day and night.
Since then, he's had a major lifestyle change and quit smoking.
Changes everybody, don't only change your life, it changes everybody's life around.
Oh God,
you.
yeah.
I was 47 when I had my first, and even at 47, I think you're going to live forever, don't you?
You got any breakfast yet?
Dan wants a full picture of this morning's episode so he can hand over to staff in A&E.
Were you going down the stairs or up the stairs?
I felt it when I was just come out of the bathroom, and I couldn't shout, you know what I mean? I couldn't make myself heard, because...
And then you passed out?
I don't remember passing out. I just remember the sweating and the twitching.
It's a short drive to Walsall Manor Hospital. If tests show Dale has had a 6th stroke, it will confirm his worst fears.
Been sent on a different job. Whiskey Victor 3, 9 uniform.
Check you with your phonetic alphabet.
They might cancel us off this, it's agreed to. Stand down. I knew that as soon as it went green too.
Oh, you are having a fudge cake.
No way, we're not going to get...
Oh,
better. Always looks a bit suspicious, doesn't it? You put your you put your lights on to get through traffic, and then you get stood down and you turn them off. The other day we were swapped from jobs about 3 or 4 times, and we were driving up and down the Lichfield Road, island to island, for about 5 minutes, and I thought, they must think I'm absolutely bonkers and don't know where on earth I'm going.
It's lunchtime on the Friday before a bank holiday weekend.
In that way, yeah.
Dan Edwards and Shane Jones have been called to a man who's vomiting in a shopping centre.
Hello, you all right? What's going on? Okay, you've been vomiting it up. Yeah? Do you feel unwell in any other way? No dizziness or anything like that? Okay. Just get a quick blood pressure on you and then we'll have a walk to the ambulance, save doing everything in here, all right?
Matthew has recently had major surgery. His dad says he only left hospital 4 days ago.
Has it just come on all of a sudden?
He's been like this for
Since the heart?
Yeah. He hasn't had nothing to eat hardly. Every time he has something to eat, he brings it immediately back up.
Yeah.
Dan and Shane have been called to a shopping centre where a man has been taken ill. Matthew has very recently had major surgery.
Do they know about all this vomiting since the operation, the doctors?
Yeah, I had to go back up the hospital, was it yesterday, to get some more medication.
And what have they said when you told them?
Nothing, they just gave me some anti-sickness tablets.
Okay. So,
I'll give you that for the walk now, just a phone if you need it.
Matthew's operation was to remove a stomach ulcer. This is his first trip out of the house.
right then, have a seat on here. Did they advise you that perhaps it might, it might take a couple of weeks for your stomach to settle after the operation?
Yeah.
Okay. Have you always been quite a small-framed character, or is it since you've had this medical problem? Have you lost a lot of weight, or...?
I've always been a bit on the thin side.
Okay.
But I think I've lost a little bit more weight.
Why did they operate on the ulcer?
Because they tried to treat it with drugs first, but that didn't work, so they had no choice but to operate.
Where was the ulcer? Was it in your stomach or in your intestine?
It was
Have you got a scar? Okay, so we're talking like intestine region, aren't we?
when he was rushed in a fortnight ago, he was just down to 6 stone.
Shane notices a pulsating beneath Matthew's skin.
Have you normally got a pulsating tummy there?
It could be an aneurysm or swelling of the main blood vessel leading from the heart.
If the mass in Matthew's abdomen was an abdominal aneurysm, we'd have to treat it very seriously, as it's a potentially life-threatening condition. For a gent of Matthew's age, he's been through a lot. He's got a lot of conditions that have put him into bed for quite a long time, so have been quite detrimental to his life with him being so young.
Couldn't feel like a butt, like if you...
No, that's just because you're quite thin. We all naturally have a pulsation there, but because there's nothing to you,
you'll see
it just seems that it's a
more
lot,
prominent.
yeah. With the scar alone, it's major abdominal surgery that you've had, so, we're talking a good month before we're going to start getting back to some sense of normality. But perhaps if your body's keeping down liquid food, soups, pureed stuff, that kind of business, then it might be worth sticking to that and then slowly building up to solids again. From an A&E perspective, I can't really see them doing anything as such that perhaps your GP couldn't do. But the decision's entirely yours. We just give you the information and you make the decision yourself.
All I want to do is the vomiting to stop and start eating again.
Dan thinks Matthew's GP can help.
Give him a ring then, try and see if we can work our magic. You don't seem too convinced.
Well, it's not with... Well, it's the doctor, it's the receptionist, so...
getting past it.
I can work my way around then. Hello, you alright? My name's Dan, I'm a paramedic for the ambulance service.
Dan gets past the receptionist.
Yeah, he's got no pain, his surgical scars healing, he's got no infection signs. It's just more he's trying to get him something for the vomiting and perhaps getting some, you know, like vitamin and mineral replacements, because he's lost a lot of weight and he's quite emaciated. Can you do 4:40 this evening? Can you do 4:40, 20 to 5, yeah?
Yes.
Yeah, that's great, thank you. Brilliant, appreciate your help, thank you. Bye. Boom.
Thank you.
If the doctor's got significant concerns and would like you seen at hospital, the benefit you've got there is they can admit you to a ward directly, so you don't have to go to A&E.
After spending 45 minutes with Matthew, they send him home with his dad.
Like I said, any problems, any concerns, the 111 number, all right, and if it's bad, there's us as well.
Yeah.
All right.
Okay, thank you for your help.
No problem
Thank
at
you for
all.
getting the doctor.
Right then. Party time, guys.
Thursday morning, the first of 4 12-hour shifts for Mike Arrowsmith and Gaz Clark.
Oh, hello. Trauma.
They've been called to an 89-year-old woman who's fallen in her kitchen. The fire brigade is already at the scene.
Medication, she's on, she's really nice.
That's Jean. Oh, blooming heck, Jean.
Oh, Jean, you're quite wedged in there, aren't you?
Not troubling anyone.
No one can work out how Jean has managed to fall into such a tight space. Her partner Len is recovering from a stroke, so has been unable to help her.
Does it hurt anyway?
No.
No?
Well, I'm lying there.
So how?
When I went down,
Yeah. How come you fell over then?
I suffer with my balance, right?
Yeah.
The balance. I did have a scan at the New Cross a few years ago, and I said it was something to do with me blood pressure.
Right.
And anyway, that falls, but nothing like this one today.
Yeah.
But I really went down. I turned quick. I thought, oh, I'm going. But I couldn't go past it all there.
Right, no.
Press that.
Yeah, no, the care line. That's the best thing to do, Bab.
Unless we can say that.
The local fire service are piloting a scheme where they respond to non-emergency calls from people who've fallen. But as they're worried about Jean's history of falls, they've called the ambulance service.
No, just keep still. Keep still. Any pain round there, my love? No. See, it's lovely and cosy under here, isn't it?
I tell you what, you've done a good job getting yourself underneath and in it. And...
I know.
So there's no pain in your hips? No. How about this leg?
Right till you get me up.
Any pain in that knee?
Oh, well, I do suffer.
Only your normal pains?
Yeah.
Wiggle your toes, Jean.
Very tired.
That's it, lovely.
I bet you've never seen me underneath of your counter, have you?
You ain't painted it, I can tell you that, love.
No, I bet it was a good clean. I'm going to clean it up.
There are no obvious signs of injury at this stage, but Jean's already problematic blood pressure is high.
What we need to do, Jean, is get you out from underneath here.
No, this is a trouble.
No, it's quite easy. We just grab your ankles and pull.
Yeah.
Okay.
We've got fire
Oh,
service.
God, yeah. With pure mechanical reasons.
In actual fact, they're going to use slide sheets to slip her along the floor out from under the counter.
1, 2, 3, slide. There you go. And we'll do it again a bit further round. 1, 2, 3, slide. That's it. Just relax again for us. How do you feel now?
That wasn't so bad up to now, is it?
No.
Didn't have to do anything.
Rather than simply lifting her onto her feet, they're using a special cushion that gradually inflates underneath her and gets her off the floor.
With Jean, she had ongoing problems with arthritis, so if we'd just lifted her underneath the arms, that could have caused her a lot more pain or even damage. So by using a lifting cushion, slowly lift her up, nice and gentle, nice and easy, nice and relaxed. All the anxiety is going to disappear, she's going to be nice and comfy, and we can get a true reading on what she's actually like.
Right, sweet. I'm just going to roll you towards me a little bit, all right? Yeah. That's it. And we're going to slide this little cushion underneath.
Okay.
Okay, then roll back forward.
Right. Now, can we see about just sitting you up a little bit?
Uncross your arms a sec. Uncross your arms. That's it. Grab onto my elbow.
Have faith in us. Bend in the middle. Bend a bit.
Arise, my child.
There we go.
And now we're just going to go up in the air.
Oh my God.
You're going to levitate. I didn't think it was going to work then. It's a bit weird because it wobbles. You just feel so unsteady on it.
It takes about a minute to get Jean upright and sitting on a normal stool.
There you go. Sit. There we go. That's lovely.
How'd you feel?
Thank you.
Any pain?
Oh,
don't do it again. Don't be throwing yourself on top of gas.
Oi.
Should we have a sit in the living room? Eh?
Yeah.
Nice and steady now.
Len and Jean have been together for 30 years, but still haven't got round to getting married. While Mike does some final blood pressure checks, Gaz decides to entertain them.
What type of cheese do you use to get a grizzly bear to come out of the woods? Come on, bear. It's like, what kind of cheese do you use to hide a small horse? Mascarpone? I've got a captive audience here. Move the Zimmer frame, she can't get away from me.
Gary's cheese jokes, they were all right once when I heard them the first time. Hearing them every shift, every job, every patient, they become a bit tedious.
Did you hear the one about there's a bomb went off in a factory? It was a cheese factory. Apparently there's debris everywhere.
Jean decides she doesn't want to go to hospital. Gaz and Mike's work here is done.
At some point, let your doctor know you had another tumble, just so they've got it on record. Yeah? And if ever you fall again, you just press that button and you get us or the Trumptons out, the fire brigade. We'll come and pick you up. You don't get Len. If he says, I'll get you up, you tell him no. Either one of you fall, the other one doesn't even attempt to pick him up. We don't want you hurting yourself trying to help out each other. Yeah?
When they x-rayed Heather's ankle in A&E, they found it wasn't broken, just badly bruised. She was told to put ice on it and rest. She's since made a full recovery. Matthew was prescribed meal replacement drinks, but 2 months later he's still being sick and has collapsed several times. His doctors have said he'll be on liquids for some time, until he fully recovers from his stomach operation. Doctors think a flopping larynx is to blame for baby Akone's noisy breathing, but he's been referred to the ear, nose and throat department for further investigation. Dale did have a mini stroke. After undergoing neurological tests and taking blood thinners, he was discharged. He has to go back for another brain scan to check for any new blockages in his arteries. John was admitted to hospital that night and taken into surgery the following day for a procedure to open up his arteries. Sadly, he didn't survive the operation.